Hello and welcome to the African Journal of Primary Healthcare and Family Medicine podcast. My name is Dr. Tiny Masupe. I am the lead author of the article that we will be sharing during this podcast. Our article is entitled Prevalence of Disease Complications and Risk Factor Monitoring amongst Diabetes and Hypertension Patients Attending Chronic Disease Management Programs in a South African Township. Why did we do this research? Well, South Africa established chronic disease management clubs for stable patients who have chronic disease within facilities or in the communities. The clubs or chronic disease management programs that we are referring to today are at facility level. The scientific gap that we were trying to address with this study was that activities in these clubs include disease risk factor monitoring and detecting of disease complications early. It was, however, not clear how well risk factors monitoring and detection of complication is done within these two clubs. Additionally, the prevalence of complications among patients attending these clubs is also not known. We therefore wanted to generate some data to improve chronic disease care by identifying gaps in risk factor monitoring and disease complication detection among type 2 diabetes and hypertension patients. The social value of this study is such that patient empowerment and improved quality of life is likely to be enhanced if complications are reduced. So what was the aim of the research? The first objective was to assess yearly monitoring of risk factors among type 2 diabetes and hypertension patients attending the chronic disease management programs in a peri-urban township in Cape Town. The second objective was to estimate the prevalence and determinants of disease complications among patients with type 2 diabetes attending these clubs. So where did we do this research? Well, this research was done in a township called Khayelitsha, which is a predominantly Black African township in Cape Town. It was done in two health facilities, also commonly called community health centers. In these community health centers, patients who attend these clubs have the following services provided for them. They undergo risk factor monitoring for disease, glucose monitoring, blood pressure checks, monitoring for complications, medication reviews, and health education, to name a few. How was this research done? Well, we undertook a cross-sectional survey of and a 10-year retrospective patient records analysis from 2009 to 2018. The population that we chose were adult type 2 diabetes and hypertension patients attending these clubs on a monthly basis. We did systematic random sampling from the daily clinic attendance register that we had access to using pre-tested study tools. So what were our key findings in terms of risk factor monitoring and disease complications? Well, let's talk about our patients' demographics. Most of our patients, 98.2%, had hypertension, while 42% had both type 2 diabetes and hypertension. Majority were female, and 42.2% had education level only as far as primary education or no education at all. Over half of those were unemployed, and similar 51.5% lived in large households with more than 5 household members. When it comes to risk factors, our patients were mainly obese and overweight at 88.6%. There was some tobacco and alcohol use at 12.7% and 19.3% respectively. Those who reported exercising at least 1 to 3 days a week were at 84.3%. So in terms of risk factor monitoring, what were our findings? Well, our findings show that several risk factors are being monitored on a yearly basis, including the lifestyle risk factors and the anthropometric measures. We found that among these risk factors, blood pressure and weight were the best monitored risk factors at 87% of both, while foot care as well as eye screening were the least monitored risk factors at 2% and 3.9% respectively. What about disease complications? Several disease complications were reported by the patients, including eye problems, poor circulation, and foot pain. There were also complications recorded in the medical records, including peripheral neuropathy, diabetic retinopathy, and diminished pulses. When we looked closely at the complications, in terms of self-reported complications, at least 22.2% of the patients reported one complication, while 9.2% reported more than 3 complications. Looking at the medical records, at least 10.11% had one complication recorded in their medical records, while 4.2% had more than 3 complications recorded in their medical records despite attending these clubs. The factors that were associated with disease complications were age, which was positively associated with both self-reported complications and medically recorded disease complications. Female gender was positively associated with medically recorded complications. In terms of perceived illness control or having a feeling or a perception that one has their disease under control, this was negatively associated with prevalence of medically recorded complications. So what are our reflections based on the findings? There is clearly inadequate risk factor monitoring. However, having said that, weight and blood pressure were the best monitored, while foot care and eye care were the worst monitored. Nearly all patients were, however, overweight or obese, despite weight being one of the highest and best monitored risk factors. 22% had self-reported at least one complication, while 20% had at least one complication recorded in their medical records. We do believe that these chronic disease management programs or clubs can do better. What are the implications and our recommendations? We do think that to provide quality chronic disease care, these clubs should consider the following. They need to strengthen disease risk factor monitoring and effectively address those that are identified, such as weight. Since weight is such a big problem in this population, the clubs need to adopt targeted health promotion strategies to really address this problem. We also recommend that the clubs strengthen the individualized self-management support for the patients, and some of the techniques that have been proven to work or to be effective include motivational interviewing and individualized behavior change counseling techniques. We also advise or recommend that the clubs conduct locally done facility-based clinical audit, just so that these help them inform their quality of care and improves their quality of care going forward. This is all we had for you today, but if you require more information, you can access the full journal article at the link provided in this slide. Thank you very much.